My name is Amit Banerjee. I'm a consultant physician and stroke physician. I've been in this role since 1999, so it is my 20th year as consultant. I arrived in the UK from India in October 92. I was fortunate enough to get a job from November 92 onwards, and since then I've been continuously employed, so that is just above 26 years. So it is my 27th year in the NHS. I've always been interested in general medicine as a specialty since my days in third year medical school, so really choosing the specialty wasn't difficult for me at all. So I did some SHO jobs in general medicine. After passing MRCP, it was time to look for registrar jobs. I chose the first specialty that I got an interview in, which was elderly medicine. And as I've said earlier, general medicine has always been my first love, so I thought this was the specialty which encompasses general medicine. I thought this would allow me to indulge in my passion for general medicine, and also give me the opportunity to develop some specialty knowledge. And in 99 I was appointed as stroke physician here. I also continue to have an interest in general medicine. I take part in the general medical rota, which I enjoy. Apart from that, I'm on call for stroke as well. I'm part of the 1 in 6 stroke thrombolysis rota. In order to progress in your career in the UK, it is important to it's important to succeed in the specialty examinations first, but that is not everything. I learned quite early on that compatibility is as important, if not more important, than ability. So it's important to get along with everyone, build up your reputation, be sincere. Another thing I realized was that an easy way to impress your consultant was rattling off data from a recently published journal article. So keeping abreast of recent developments always earned you brownie points. And apart from that, you have to be sincere, you have to be knowledgeable as well, and the rest follows quite smoothly, I thought. There were a few challenges that I had to face after arriving in the UK. In terms of working life, I was not really accustomed with the technology that we take for granted in the UK. For example, I already had a postgraduate degree in medicine when I arrived here, but I had never done a single blood gas estimation. After coming here, I realized that blood gases were done at the drop of a hat. I had to learn it from a house officer who was quite a few years younger than me. So it was a rather sobering experience. In terms of social life, yes, so we had a few problems. About 3 or 4 months after I arrived, my wife and 4-month-old son arrived as well. So we had a good family life. But the problem was that we were moving around every 6 months, or at the most 1 year. So we didn't have enough time to build up a vibrant social life. But as I said earlier, I've been in the current role for nearly 20 years. So that deficiency in the social life has been addressed. I'm happy to say that I have enjoyed an enviable social life in the last 20 years or so. My friends who live in India are quite envious of the social life that I enjoy. And in terms of adjusting to working and living in the UK, well, after the initial hurdles were overcome, I realized that working in the UK was actually less challenging than working in a developing country. It is mainly because of the superb infrastructure that is available to you. In fact, you could ask whatever investigation you wanted to. You could seek opinion from any specialist that you needed to consult. So really, It didn't need too many. In fact, working in the UK was quite easy and far less challenging than I had initially anticipated. Living in the UK posed a few problems as well, which we were able to address. Firstly, the weather. Well, I had never seen snow before arriving in the UK, but I realized that if I am to live in the UK, I should dress myself. I should dress myself appropriately. I tell people visiting the UK that there is no such thing as bad weather in the UK. You must come appropriately dressed. And I missed my parents and friends from India, but that was also addressed with the help of technology through through video phone and Skype technology. I'm able to speak to my parents 2 or 3 times a day, so I don't seem to miss them as much as I did 26 years back when I first arrived in the UK. Living and working in the UK has been fabulous, to put it shortly, which is why I've ended up staying here for more than a quarter of a century. But the favorite things about working is that unlike in India, where I practiced for a few years before coming here, you don't have to worry about whether any particular investigation or treatment is affordable to the patient, as affordable to the patient or not. If you think it's needed, you can just request it. And then the NHS provides a superb infrastructure, and people overall are very polite and grateful for the care that we deliver to them. I've recently heard that colleagues in India have faced verbal as well as physical violence from patients and their family members. It may happen in the UK, but incidences like that are few and far between. And living in the UK also has its advantages. Most of the time, I quite like the weather. For example, while speaking to my parents earlier on in the day, I heard that it's already quite warm in India by now. Yet look, we are enjoying such fabulous weather here. So most of the time, I quite like the weather. The fact that there are other advantages to working in the UK as well. Like, friends who work in America tell me that society is very litigious. It's not as litigious here as it is in the USA, but some degree of fear of litigation is good. It encourages us to be accountable, which is another thing that I like about practice of medicine in the UK. And as I said, we have been here for 20 years. We have a very wide and impressive circle of friends that has enriched our social life. The working pattern in the UK is very conducive to the development of a social life. Like most days when I'm not on call after 5, I can enjoy time with my family and friends. Colleagues working in India often have to be busy until about 10, 11 at night. Even when they're away on holiday, sometimes they have to be contactable. I shudder to think of a situation like that. So as I was saying, there are many benefits, many blessings about living and working in the UK. I hope I've given you a flavor of that. My advice for international medical graduates would be that UK continues to be a fabulous place to work. Yes, there are challenges because of resource constraints, but overall society in UK has addressed these challenges. So we are free to order the investigations that we need. We are free to implement the treatment that is best suited to our patients. And the other thing to say is that there are many vacancies in training posts in the UK. I've heard that immigration rules can sometimes be a bit difficult to get around, but because of the fact that there are so many vacancies, I think this is a very good time to train in the UK. If you have a specialty in mind, that's good. Aim for the examinations. try and get the specialty exams out of the way. That would certainly facilitate your training path. Even if you haven't thought of your specialty yet, it doesn't matter. Enjoy the training that UK provides, but do think of a specialty. The sooner you get onto the specialty ladder, the better it is eventually for your career. There are some challenges which I've alluded to initially. The accent can be difficult to understand in places, but don't be put off by that. There is no shame in seeking clarification. If it's something you can't understand, saying that, sorry sir, I didn't get what you said, please could you repeat the last sentence. This can solve your problem most of the time. And don't be afraid of seeking help either. One dictum that I followed was that if in doubt, shout. So if you think you need help, don't hesitate to ask for it. In fact, your seniors will often be grateful if you seek help earlier on, because that is a good way of nipping problems in the bud. So as I was saying, this is a very good time to train in the UK. I know that in most specialities there are plenty of vacancies, and although the immigration rules can be a bit difficult, if you persevere, I think you can get into the specialty of your choice. You may not be able to train in the place of your choice all the time, but I think there are enough training posts for the international medical graduates who are in the UK at the moment. So all the best. So if there is anything else to share with international medical graduates, I would like to utilize this opportunity to make a case for Scunthorpe General Hospital. This is the place that I've made my home. This is where I've stayed for the last 20 years or so. I would like to encourage you to come and check out this place. This hospital offers excellent training opportunities, and life in Scunthorpe is of a very high quality as well. If truth be told, soon after arriving here, I was hoping to move on after 2 or 3 years. One of my options was to go back to India, or maybe seek a consultant position in a bigger teaching hospital. But then I realized that the quality of life that this place offered was no worse than what it would be in a place like London or Manchester. I live only about 5 minutes drive from the hospital. Colleagues living in London have to spend more than an hour each way in the tube. So that way, I think even when you are in the UK, living in even if you're living in a small town, you have a quality of life that's not inferior to what a big city can offer. The same thing applies to your patients as well. Even if you need a sophisticated test, it will always be accessible. The patient might have to travel, but it doesn't seem that your practice will be restricted by your inability to live in a big city or practice in a big teaching hospital. So if I have the chance to say something else, I would like you to come and live in Scunthorpe and check out the opportunities that Scunthorpe General Hospital offers. I am quite sure that you will enjoy your stay here. All the best.